Vitamin D in breast cancer. We know that women with normal vitamin D levels have markedly lower incidence of breast cancer, about 50% less than women with low. Almost every woman that walks into my office, we always test their 25-hydroxyvitamin D, and they're almost always low. All of you should know your 25-hydroxyvitamin D level. That goes for men too. Also, deficiency of vitamin D, if you have a low level when you're diagnosed with breast cancer, you have a markedly higher chance, 94% of developing metastatic disease and a 73% higher chance of dying if you have low levels as opposed to normal or high normal levels. Critical for everyone to know this. And I'll mention, just while we're on the vitamin D, if you eat a good diet for vitamin D, salmon, cottage cheese, dairy, the most you're going to get is 350 units a day. If you're living in New York where your body's making no vitamin D between November and April because of the amount of sun we're getting, it's impossible to get that. For living in the Northeast, you need at least 2,000 units a day for most people. Now, green tea is one of the most widely consumed herbal medicines in the world. It is profoundly anti-cancer. I could give, and I do give, whole lectures just on the health benefits of green tea. But we're here to talk about breast cancer today. There is not enough good I can say about it. Now, one big confusion, and the biggest myth, I think, in America today, is that soy is bad for you if you've had breast cancer. Nothing could be further from the truth. It has been looked at. If you really understand the data, some of which I'm going to tell you, you'll understand that dietary soy, miso, tofu, tempeh is not only not dangerous, it is good. So the reason some people were afraid of it is because they said, well, there are phytoestrogens in soy. Phyto means plant-based. So there are. But the isoflavones in soy are about 1/5,000 is estrogenic, is the estrogens that are found in the human body. And we know from epidemiologic studies that if you look at breast cancer in Japanese women living in Japan, you can see in the first part their incidence of breast cancer. The first generation living in the US, if they move, it goes up, and by the second generation, it continues. So part of the reason is because women are consuming a more Western diet when they move here with less soy, less green tea, less fish. Now, if you look at soy isoflavones and breast proliferation, they looked in human subjects, postmenopausal women, to either who had had breast cancer, to an isoflavone tab versus placebo, and they biopsied the non-involved breast from breast cancer over a period of time and found no increased breast cell proliferation with a really high dose of soy isoflavones. Now, I want to say a little bit about sugar. Sugar is not all bad, but refined sugar, white flour, is all bad. Sugar that comes from honey, sugar that comes from fruits, those are fine. Agave nectar is fine. The natural sugars have what we call a low glycemic index. Once you process them, it takes a lot of insulin to metabolize them. Insulin promotes breast cancer. But even worse, every time your pancreas has to make insulin, your liver is making something called IGF, or insulin-like growth factor, the strongest tumor promoter we know of for a variety of cancers, including breast. Now, there is a drug called metformin that was approved in France first in the 1950s. And it came from the French lilac. It was approved in the US in 1994. And it just makes your insulin work better. And it's been found to have cardiovascular benefits because diet high in white sugar is the major cause, not fat. It's the major cause of heart disease. And so what happens is with the metformin, they were doing a study in women with very large breast tumors, in which we have to give chemo to try and shrink them down. It's called neoadjuvant chemotherapy. And the study just wanted to look at diabetic women, just see how they did. Some of the women were on metformin, some were on insulin, and some were on some of the newer anti-diabetic drugs. They found that the women that happened to be on the metformin had a 3-fold increased pathologic complete remission rate compared to women on the other drugs. And we now know that metformin inhibits numerous enzymes cancer cells need to grow and divide. It's profoundly anti-angiogenic, and it is used preventatively. I have most of my patients over 50 years old, men and women, on a low dose of metformin. I take it myself, 500 milligrams a day. The dose, if you're a diabetic, this starts about 850 milligrams twice a day. For cancer prevention, you can start at only 500 milligrams a day. So there are also a number of amino acids that are very important in people that have had cancer. Glycine is a non-essential amino acid. Numerous studies show it's profoundly anti-angiogenic. Taurine helps cells die normally. It's called pro-apoptotic. And glutamine also is associated with a lower incidence of cancer and better response to chemotherapy. So we know that people that have diabetes and elevated fasting glucose levels, it's associated with a 27% increase in cancer mortality in men, 31% in women. The reason for this, they have high insulin-like growth factor as well. There was a paper in the Journal of Clinical Oncology in 2002 that was just looking at IGF and insulin levels in women with early-stage breast cancer. They found high levels of fasting insulin identified women with poor outcomes who more effective treatment strategies need to be explored. So it's not obesity, for instance. We know if you're overweight, you have a higher risk of breast cancer. Why? Because you've got higher insulin levels, higher insulin-like growth factor. Same goes for men. And I think that it's very key that people realize what they can do. And so the major things that I would say to my patients that you should try and do: avoid white sugar and white flour. You can have all the sugar substitutes I mentioned. You always want to take the skin off chicken, fish, or turkey before you eat them, because the skin is the fat. That's where all the environmental toxins go. It is very important. Nuts are very good. All nuts, it's best to get them in their raw form and the least processed form, because once you start roasting and heating them, you're creating a lot of damaged oils, and that has a pro-oxidant effect. So you're creating free radicals, which you don't want. So nuts are good, but only if they're raw, not roasted. And I would say peanuts really aren't nuts. They're legumes. I'd stay away from them. Peanut butter, peanut oil, I would stay away from, because it has a very bad mix of omega-6 fatty acids that actually promote inflammation. When you're thinking about oils, olive oil is great. It has squalene, it has very good omega-3s. In the countries that eat the most olive oil, they have 70% less breast cancer than other countries. Those are the Mediterranean countries. But the second you heat olive oil, all the good things in it denature. So it's good on salads, it's good on dips. It doesn't do any good to heat it. All the plant-based oils that maybe a lot of you use, safflower oil, corn oil, same thing goes. Most of those are processed at high heat. You have to get raw pressed oils, just like you get the virgin olive oil, the cold pressed virgin olive oil. You have to look. You can't just go into a store and buy the regular oils that have been subjected to high heat. You're just putting carcinogens into your body. And also, the best oil for cooking is grapeseed oil. It has a high heat coefficient. It doesn't break down to those things. And there's a big myth about butter. Butter is not something that should be avoided. Butter is loaded with CLA, or conjugated linoleic acid. Conjugated linoleic acid causes breast cancer cells to die. It has a nice side benefit also. It causes fat cells to die. And so I put a lot of my patients on a CLA supplement, about 1,000 milligrams twice a day. There's a tiny bit found in plants, not enough to be at all therapeutic. A lot of people need a supplement. In India, they have a lot of CLA in their diet because they all cook with ghee, which is clarified butter. And so they're having enough CLA in their diet. They won't need a supplement. And the reason it's not found in plants so much is cows are capable of converting linoleic acid to conjugated linoleic acid, but it's not going to be found in nature too much. You want to balance your diet to about 1/3 carbs, mainly including whole grains and vegetables. You're going to have about 1/3 protein, and that can come from lean meats, fish, beans, and about 1/3 fat, which should be about 3-to-1 omega-6 to omega-3 fatty acids. I don't tell people they need to become macrobiotic. I don't tell people they need to even become vegetarian. If people want to, it's fine, and if they feel okay with it. But it's really that balance that's essential. And it is harmful over the long term to take all the fat out of your diet. Because what will happen, at first people will lose weight. You know, they'll be vegetarian, they're not including any fish or any meat. And initially they'll start to lose weight. But what will happen is they'll start metabolizing muscle, okay, because they're not getting enough protein either. And muscle burns 3 times as many calories as fat does. And so eventually their basal metabolic rate goes down, and so even though they may be getting less calories, they'll put the weight back on. So you see a lot of people that get into that problem. Initially they lose the weight. So all the fad diets that are out there, the reason none of them work long term is because it doesn't have that balance. So it's very key to have that throughout the day. And I'd just like to leave you with a thought. Everybody fastens their seatbelt before they drive a car to prevent fatal auto accidents. Everybody brushes their teeth at night to prevent tooth decay. But all of you can take the same type of interventions on a daily basis by keeping in mind your stress level and the foods you're putting in your body to minimize your risk of cancer. Thank you.